Hello, everyone. I am very excited to have with us Tracy Harrison, the founder and chief educator at the School of Applied Functional Medicine, and Jody Franklin, a graduate and practitioner of functional medicine. I'm Lisa Hanfileti, the founder of Acupuncture Business Academy. And as a very proud acupuncturist and practitioner of Chinese medicine, I am here introducing you to Tracy and Jody because I really see now through experience that functional medicine combined with Chinese medicine really gives us a really unique opportunity to uplevel and shift the way we use our clinical practice, the way we have our business set up. So you will learn some clinical pearls here, but this really is about you opening your mind to how you can shift your business. And one of the reasons why I feel like this is so important for us to sort of have a different perspective on how we use and promote Chinese medicine is because our patients are now very, very familiar with virtual medicine. And it's just going to keep getting broader and broader in the uses in terms of virtual medicine. And with acupuncture, we're very high touch. We're very in the clinic. We're one-on-one. And when you incorporate the knowledge and the principles of functional medicine, it gives you the opportunity to expand your practice into the virtual world, as well as continue to do what you're doing one-on-one. So I think that what we do, the combination of these things is an opportunity for us. So I want to hand this over to Tracy and to Jody. And again, say thank you for coming here, showing us how to uplevel our clinical toolbox on gut health and using that as an example for how we as acupuncturists can kind of look at our practices a little bit differently. So welcome and thank you for being here.
Thank you so much, Lisa. It's such a pleasure to be here again. And I know you personally have had a transformation and with your husband. And I know that sort of changed your mind about functional medicine. At first, you were a little skeptical of it. And now I know that you have been, I've been working with him. You're very public about it. And his Parkinson's is going into remission, which is so exciting. I just love it. So thanks for having us. And I really, really appreciate it. We love acupuncture. We're always recommending it to our clients as well. But
Indeed.
today
Here.
yeah, absolutely. And today we're going to talk about how to up-level your clinical toolbox with using gut health. And this is an amazing tool that really mastering gut health and how you can take your practice to the next level with that. So before I start, I just want to tell you if you could all just kind of silence the notifications on your phone and enter questions that you have in the chat or in the question tool, or if you're on Facebook, put them below. And we'll try to get to all your questions, but stick with us to the end. And we're going to give you a way around some of the challenges you may be facing in your practice. So looking forward to going through all that. But first, I want to tell you a little bit about me. First, let's talk about these issues here. I don't know if these are kind of, if they resonate with you at all, but I learned the hard way how essential all these points are and not really getting the kind of results I was looking for, both with the clients I was working with and financially. I wasn't really standing out as much of an expert in my field as I wanted to. And we're going to show you ways around that so you can really get a booming business and take your practice to the next level. And now I'd like to tell you a little more about myself. So I wanted to tell you that I had a change in life. I actually started this midlife career of mine when I turned 50. I was very inspired to help others after overcoming so many of my own health issues. And I went back to school to study first nutrition, and then I did some self-study on functional medicine. I read books, I listened to podcasts, and I started taking on some clients. But immediately I felt over my head, which was a hard pill to swallow, and I had a lot of insecurities. And I was trying to help people really overcome their health issues, but I wasn't always getting the best results for them. I started having some mild success stories, but I felt like I needed more in my toolbox. In spite of my best efforts, they weren't doing as well as I wanted to. But another thing that was really disheartening for me is I had these visions that I could be financially independent with them. My kids were going off to college and I was not making a lot of money at all. I was charging very little for my services, maybe what an acupuncturist would charge for an hour session kind of money. But I wasn't doing the hours that you guys were doing. So I didn't really have that kind of security either. And frankly, my clients were not referring people to me. I really didn't have a lot of confidence. I was going out in the community trying to get clients, but I wasn't getting any referrals. They might work with me for a session or two or three, but they weren't coming back. They were ghosting me. And most of them weren't signing on for a long-term contract with me. And I remember sitting at night with my head on the pillow, wondering if I'd made the right choice because I gave up another career opportunity to get into this line of work. And I had invested a lot of time and energy in my prior education. And I wasn't helping people on the level that I knew I could, and I wasn't having the impact I wanted to. And I certainly wasn't making very much money doing this. So my business was definitely suffering. I wasn't charging much, as I said. I wasn't getting referrals or testimonials or anything. But um, but anyway, I was getting a little anxious about it. And I wanted to tell you that things changed for me in a big way. I actually met Tracy, who's here today, the founder of the School of Applied Functional Medicine, and it was life changing for me. I remember seeing her at a webinar and I was blown away by her level of knowledge. I was one of those people that was reading all the books about health and finding out as much as I could, but she was saying things that I hadn't heard before in spite of all my education. And she gave me these incredible pearls that I could just take back to my practice right away and start using them and start getting better results right away for the clients who came to me. And so I gained an incredible level of confidence and competence. My clients started raving about me. I got referral after referral after referral. And in fact, I know Lisa has referred several other Parkinson's patients to me because I'm having such amazing success stories that she keeps referring, and those people are going into remission with their Parkinson's. And of course, it's very related to gut health, which we'll get into in a minute. But I increased my rates over 1,000%. So I want you to take your hourly rate, if it's $100 an hour, and add a zero to the end, because that's the potential here for an hourly rate. And so it made a huge difference. Or even if you double or triple your rates, it can make a huge difference in adding this dimension to your practice. And I expanded my practice. I have more team members now. They're all graduates from the school. It's hard to find graduates that aren't already too busy with their own practices, but I have them on my staff and they help me take on more clients. And I also have introduced a group program. I just had that today. I have a vanishing vitiligo program. We've had over 40 students go through that program. I have another group program on the way. So I can have so much more impact. And I became so passionate about what I'm doing that people started working with me worldwide. And that's just so exciting. I know one of the clients you referred is in Australia, Lisa, and I just had someone from Saudi Arabia come to me. So whether you do it in your own practice locally or you do it as an online practice, you can do either. And that's something you can't really do with straight acupuncture. It's hard to do that online. But this is a way to add another element to your business. Perhaps you could work from anywhere eventually if you wanted to do this kind of work full time. Acupuncturists do so well in this field. We have so many that have gone through our program already, and it makes so much sense. You're with your background and your knowledge that you have already. This can just take your practice to an entirely new level. So anyway, I want to show you a couple case studies. This client came to me with really bad fibromyalgia, and I know you all work with a lot of fibromyalgia and fatigue and migraines and things like that. And of course, acupuncture can be really, really helpful to alleviate those symptoms. But she had already been to some practitioners and she wasn't really getting anywhere. And with all these symptoms, she was on Vicodin every day for her pain. She got in bed at noon every day and couldn't get out of bed. She couldn't be a mom to her kids. And it was very disheartening for her. She was really a mess and she was covered with hives, just really feeling awful. But it was all stemming from her gut issues that she had. But fast forward, what we did some interventions. As I mentioned, she'd already been to a she'd already been to lots of Western physicians, but she also went to a functional medicine physician. I was a little nervous taking her on because this was my first semester in the program at safm. And she had already, been to a functional doctor. And here I was like, how am I going to help this woman? But I knew I had the backing of the school to help me. And fast forward, I was able to figure it out using the resources in the school, which are incredible. And within just a few weeks, her migraines were gone. This is the type of thing where she didn't have to come back frequently to get acupuncture treatments. It was just completely gone. And her joint pain was gone within 8 months, completely gone. Fibromyalgia pain gone. Hashimoto's, her autoimmune antibodies were cut more than 50%. And her hives went away, her pain went away. She went off all her medications, and now she's a bundle of energy. She feels fantastic. And in the process, you could see the before and after, she lost 90 pounds of unwanted weight. So just amazing success story. And she's told her husband started working with me, her brother-in-law started working with me. She's told so many people. In fact, her doctor has referred a whole bunch of people to me because he couldn't believe the differences in her. And he asked, who are you working with? Can I refer people to her as well? So I just started building a practice just with a few clients that I took on and the success stories that I took on. And I'll show you another example of one of the success stories that I've had. This is John, who came to me from Idaho. His wife had heard of me, and he was very skeptical of working with me. He had really bad psoriatic arthritis. In fact, that's his thumb on the top there. He couldn't even tie his shoes. He was in such pain. He was on prednisone off and on, and he would always flare when he tapered off, but he knew he couldn't stay on long term. He was concerned about getting cancer. And, he had some weight issues and limited mobility. And he was not the easiest of clients. He was very skeptical. But within 5 months of working with him, his psoriasis went away. and his pain went away. And he lost 30 pounds as well in the process. So you could see that this really works. And by healing his gut, where psoriasis really begins in the gut, digestive function is a huge part of why people get psoriasis in the first place. By healing that and going through all the different interventions, we were able to heal him. And he has referred, I don't know how many clients to me. I have a whole bunch of clients from Idaho, this little pocket of Idaho that have come to me because he runs around telling, like, he's giddy about it now and tells everybody about me, which is really great. So, uh, moving forward, this one more quick case study. You can see this case of bloating. I'm sure you get some of these in your acupuncture practice. She had tried a lot of different interventions, been to GI doctors left and right, and continued to have constipation, diarrhea, and gas, Raynaud's disease, and fatigue and acne. And you can see, fast forward, the 5-month pregnant look went away, and she feels fantastic now. She's actually referred her running buddies to me. She's a marathon runner. So um, I've worked with a lot of people, including her son. We were able to reverse his asthma, and some of her friends who she runs with, I've worked with a bunch of them. So super fun to do this kind of work. And you can see a little bit of the success stories I've had and how these people are referring people to me and how I built my business and been able to raise my rates and have this level of success. So we are going to talk about up-leveling your toolbox today, how you can not just, you may be having some good client outcomes, but maybe you aren't as fulfilled as you want to be in this field. And maybe you feel like you want to expand your toolbox to include things like gut health, to make things so that your patients absolutely rave about you and they tell all their friends about you. And rather than having slow growth and not enough income, you're going to turn around and probably have more than you can handle. In fact, I am afraid to send out a newsletter. I'm afraid to post a success story on my Facebook account or TikTok or whatever, because I know I'm going to get a whole bunch of people that are going to want to work with me, and I don't necessarily have the bandwidth to work with a lot more people that I'm already working with. So it's a good problem to have, and we want to get you there as well. And I know I can even raise my rates further if I wanted to, but I want to be accessible. I can always slide my scale for people that don't have as much income, but the people who do, I'm making sure that I'm bringing in a good level of income as well. And I no longer have imposter syndrome. But here is my secret. I want to introduce you all officially to Tracy Harrison, who is absolutely brilliant, the educator and founder of the School of Applied Functional Medicine over a decade ago. And her background is in chemistry. She's a scientist. She actually has 3 degrees from MIT and a lot of extensive postgraduate work in functional medicine as well. I swear she eats research papers for breakfast because she's absolutely brilliant. And I've learned so much from her. And honestly, this is the key to the success of my practice. I could not have done this work without her. I could not have got the level of success stories that I have without the school, because she teaches you not only the science, but also how to effectively apply what you're learning into your practice immediately. So that's what's really made the difference for me. So Tracy, thank you so much for coming on today.
Thank you for that lovely introduction. I really appreciate that. And thank you, Lisa, for the opportunity to be here. But I just want to celebrate, Jody. You're the example. What a great role model. And I love your case stories. Not just amazing outcomes for these individuals, but also how they naturally, through I think the reciprocity and the desire to give back when they have amazing results, they tell everyone they know. They're enthusiastic referral sources, and that really can fill a practice. It's amazing. The difference between mildly satisfying someone and wildly satisfying them is can make all the difference in terms of really filling your practice for continuity and growth of income. And I chuckled with what you said about afraid to post another example because you're going to get so many referrals. My goodness, what a wonderful challenge to have. But I just want to say as I get started here, the examples that Jody is giving are not a stretch at all. I mean, this is really the power of well applied functional medicine, and being able to really get at the true roots of disease precipitation in a unique individual. I'm appreciating, even with everything I know and everything I've seen in functional medicine over the past 15 years, you listen to stories, to case examples like this, and it almost seems too good to be true because of what we've been led to believe about chronic disease. But the reality is, we have the pleasure of seeing examples like this on a weekly basis. People are celebrating amazing results on really complex cases. And I think it's an opportunity for really dramatic professional fulfillment that's possible for of all many different types of practitioners. But I echo very much what Lisa said earlier. I think there's wonderful synergy between Chinese medicine and the overall holistic integration of the body and the integration of physiological systems with lifestyle and a life environment. There's a wonderful common lens on the body and on health and disease that makes applied functional medicine, I think, very accessible to acupuncturists. But I very much appreciate the introduction, Jody, and I wanted to take the opportunity to just share with everyone here some pearls about addressing gut dysfunction. Ultimately, what we're talking about here is being able to accelerate recovery in your patient cases, being able to improve clinical outcomes by transcending a lot of the typical hiccups or barriers that we run into, especially with stubborn or recurrent disease. And I like talking about IBS, right? That classic sort of GI distress that people have. And of course, IBS is not really a diagnosis per se. It's really just a label we agree to give to a set of symptoms. And as I'll well demonstrate today, the actual drivers and mediators of IBS can be widely varying from patient to patient. And this is where we need to be confident about diving into the detail in order to truly resolve it, not just to reduce the symptoms and provide some relief. That's important, of course. But the goal here is really a much higher bar. It's about being able to truly resolve the dysfunction so that people return to a resilient state of vitality. But I call this a textbook case because Marilyn, a 70-year-old at the time obese woman, was struggling with bloating and flatulence. She had been diagnosed a couple of years earlier with IBS that had been progressively worsening. In particular, she had really notably aromatic and loud flatulence, which was really embarrassing to her. She'd been struggling with acid reflux, which had progressed to the point of really causing a chronic sore throat and a raspy voice, and she was worried for the health of her esophagus. And these are the classic kinds of cases. I'm sure you experience these frequently in terms of GI distress in the realm of acupuncture as well. But seemingly textbook on the surface cases can actually be really challenging if we're not getting at the nuances. Marilyn actually worked with a practitioner, Casey, who actually presented her with some wonderful education and interventions on good basic remedies for gut imbalance. Helped her to clean up her diet, getting rid of refined carbohydrate foods and a lot of chemical additives in her diet. Helped her to stop with late night eating that was undoubtedly contributing to greater incidence of acid reflux overnight. And the practitioner was able to give some good logical supplement recommendations, a multivitamin, a probiotic, a fish oil, a vitamin D, fairly common supplement suggestions, and then also a carminative herb formula. Carminative herbs such as fennel and ginger and peppermint are often included in supplement formulas designed to counter gas and bloating because it helps to release or actually to dissolve retained gas in order to provide some symptom relief. There were a lot of things that the practitioner, Casey, was well recommending, and certainly those would be textbook type of solutions. But the challenge was that they met multiple times and Marilyn adopted all of Casey's recommendations, but she was not feeling better. In fact, she was feeling worse. And we all know that that can be very frustrating, right? Sometimes people don't get relief or they only get a little bit of relief. And of course, we want more for them. They want more for themselves. And so Casey tried to come up with additional ways to focus in terms of addressing the root causes, looking at what might be triggering it. Maybe there was some food sensitivity or immune system reaction to food. She recommended a gluten-free diet and helped Marilyn to adopt to that consistently. Her symptoms were still worse. Well, wanting to look even further, maybe this is maldigestion that is at the roots here and recommending that Marilyn use some digestive enzymes to support her degradation of food. But even that further intervention only left Marilyn feeling about 10% better. And so 3 months into their program together, what we have is a patient who's frustrated and a practitioner who is frustrated. And it can be very easy for any practitioner to just try to follow a protocol, right? When they have these symptoms or when they have these diagnoses, we just follow this standard approach. And what we know from having taught thousands of practitioners over the past 12 years is that while protocols can be helpful to some degree as a foundation for learning, right? We must develop the ability to customize a plan for a unique individual if we're going to truly get at the roots so that they can fully resolve what's promoting disease in their body. Right? And so when we think about how do we resolve the nuances in Marilyn's case and why was she feeling worse, not better, with through the lens of applied functional medicine, you start to see a number of things stand out right away. Well, Marilyn started taking vitamin D in working with Casey and jumping right in to a notable dose, but certainly a common dose. 5,000 IUs is something that a lot of people are taking and purchasing over the counter. But the nuance here is that vitamin D metabolism requires magnesium for multiple stages. And it's actually quite common for individuals to start taking higher doses of vitamin D and they end up with symptoms, negative symptoms or worsening of symptoms that they might associate with vitamin D, or they might call it vitamin D toxicity. But actually, what's happening is that the usage of vitamin D is depleting their magnesium behind the scenes. And magnesium is already a common borderline nutrient deficiency. And when we have inadequate magnesium, it impairs appropriate muscular contraction and relaxation in the body. And this is often a contributor to acid reflux and also to any type of bloating or distension in the GI tract. And so again, the order of operations here was a challenge. The carminative herb formula that Casey recommended was appropriate for the gas that Marilyn was struggling with. But in this case, the formula contained peppermint. In fact, that was the dominant ingredient. And another nuance that's important to consider is that peppermint will exacerbate acid reflux, in some cases, really quite dramatically. So, use of peppermint supplements or mouthwash or toothpaste, these types of things can actually be a trigger for acid reflux and was responsible for Marilyn's worsening of GERD. So we needed to make some course corrections, right? We pulled away the vitamin D, stopped it entirely, and began magnesium support, which within the first 10 days actually brought Marilyn some significant relief for her acid reflux. Magnesium is a common mineral deficiency that certainly becomes more common as we age. And we replaced Marilyn's carminative herb formula with one that was a pure phenol formula. And she did indeed get some nice relief from her bloating with that formula and was able to maintain the progress with acid reflux. But we needed to delve more deeply into Marilyn's history. The functional medicine lens teaches us to always ask not so much what disease does this person have, but who is this person? What is it about their unique way of showing up in life, their lifestyle choices, their physiology, their genetics, their history, that we need to be considering in customizing a plan? And even though Marilyn at 70 years old was obviously long postmenopausal, it was of note in delving further into her history that she had long-standing challenges with heavy menstrual bleeding and intermittent anemia as a result of that, and also really strong PMS symptoms. Now, this is, of course, a cue for us that she likely struggled with what we might call estrogen dominance, which speaks not to estrogen being a harmful or a negative thing, but the fact that anything in the body can become imbalanced. And we can end up with challenges with regard to biotransformation and clearance of estrogen. And this, of course, may be exacerbated by genetic challenges with regard to estrogen metabolism. But one of the things that we can still be experiencing, even well postmenopausally, is endocrine effects, including estrogenic effects, as a result of toxicity. And indeed, endocrine disrupting chemicals, or EDCs, is a common nemesis in individuals' personal hygiene and beauty products. And when we were doing a just more thorough inventory of who is Marilyn and what are her choices in life look like, she was quite proud of her focus on maintaining her beauty into her senior years. And she used quite a number of beauty products, including all sorts of creams and tinctures for her skin on a daily basis. She colored her hair in order to keep it nice and dark black as she aged. And every week she had her nails professionally manicured and the nail varnish changed. Heavy use in these products, in particular of phthalates, which are potent endocrine disrupting chemicals. And this is the type of nuance that you can learn about that we associate with the gut because strong estrogenic effects promote bile congestion. Heavy estrogenic effects actually increase the concentration of cholesterol in bile, which makes bile thicker and often leads to hepatic biliary congestion and poor gallbladder emptying. Now, over time, this can increase the risk, of course, of gallstones and gallbladder disease. But absolutely, along the progression of that disease dynamic, we can end up with challenges with regard to gallbladder emptying. And this is an often overlooked contributor to irritable bowel syndrome. And poor fat digestion is actually a common root cause of acid reflux. And so in this case, what we needed to do was a rich inventory of Marilyn's beauty products. And we actually ended up replacing over a dozen different products and opting for much lower toxicity items. In her particular case, we also needed to get rid of the hepatic biliary congestion. We use taurine for that, which helps to thin bile, and artichoke, which enhances gallbladder emptying. Once we had been on that regimen for about a month, Marilyn also started increasing her intake of good extra virgin olive oil, and the high polyphenol content in good quality fresh olive oil also encourages gallbladder emptying. D-limonene is an extract from citrus rinds that also helps the liver to release incorporated fatty infiltration. And so we were able to engage in something that was not only helpful in fully resolving Marilyn's IBS symptoms, but also addressed a notable source of toxicity in her personal hygiene products, and also noted blockage in her detoxification pathways that would have undoubtedly eventually led to some liver function challenges. So the bottom line here is that 3 months into this course correction, Marilyn's gastrointestinal symptoms were completely resolved. And more importantly, she was on fire with this knowledge about interconnected function in her body. And in fact, Marilyn was able to enthusiastically refer not just one, but 5 of her Bridge Club friends to Casey's practice. And a great example, as I mentioned earlier, of that enthusiasm and I think natural sense of reciprocity that individuals feel and act on when they're wildly satisfied. And this is the type of nuanced understanding of the gut and how the gut is affected by all the other body systems and so many lifestyle choices that you can leverage to dramatically accelerate recovery and to really build your reputation as very much an expert in addressing root causes of disease.
It's amazing. It's a real puzzle piecing case.
Mm.
And you learn how to put all these pieces together and map things out. And like, I know you all use maps as well, but I feel like now I have it's like a superpower. You have the confidence and competence to help just about anybody with anything. So a case like this is like any student of the school could work with this and get this person wildly satisfied. So it's just amazing that the difference when you have this knowledge. I'm so glad you brought up the case.
Yeah, thanks very much. And I have another one too, if we can delve into that, because
Oh,
Bef-
Lisa's
before
raising her hand. Go ahead.
Yeah.
oh yeah, sorry.
Yeah. Before you move on, I just have a couple questions because one of them happened when Jody was talking about her practice and how I remember, Jody, you said that it was in the first semester of your training that you were working with the gal with fibromyalgia and all the other things. And that segued into this case study, Tracy, that you just gave, where you talked about, Casey is the person treating this person and you had to do a course correction. And so my question is about how does a student get access to you to do these course corrections or to get help in the first semester where I would be just, beside myself trying to figure out how to do all this stuff? What kinds of things do you have in place that help somebody when they're just starting out learning this?
It's a great question, Lisa. And to set the context, first of all, so all SAFM students are active practitioners. So that's everyone has a practice, everyone is seeing patients or clients, everyone already has their appropriate license. And we encourage that because we want everyone to be well established in their modality. and have people in their practice that they can begin to support right away. Now, obviously, no one is expert just a few months in, right? To your point, we do encourage practitioners to begin to apply their learning along the way, right? Because functional medicine obviously builds on itself, and there's no better way to build good confidence than really being able to use and do the deep dives into the cases and the wisdom that comes from them. So we have a practitioner forum that students participate in all the time in order to share their case examples with one another, as well as with a group of mentors that are available to provide guidance and insight. And so this is a place where you can say, here's the case, here's what I've done, this is what's working, this is not working, what am I missing, what have I tripped over? And you can get feedback not only from our team, but from others, from other traditions, other modalities, people who may say, oh, I had a case just like this, or that's actually my expertise, or here's a great paper I found that you can learn more about that. So that type of support is available all the time to students. And we also have this awesome resource called the Q&A Treasure Chest. It's kind of a tongue-in-cheek name, but it's a really wonderful resource that has hundreds of case questions and lengthy write-ups about what is at play in this particular case. So you can, to Jody's point, you can search on the word fibromyalgia. You can search on the word psoriasis,
Parkinson.
Parkinson's, right? And be able to go and get not only a good curated research references to check out to learn more about it, because you may not be at that point in the curriculum yet, for example, but you also will get a whole list of real specific clinical recommendations and when to consider it and when not to. So we try to have a lot available immediately so that people can begin to practice right away. I use the analogy that learning to apply functional medicine is a lot like learning to swim. You can read about it, you can study it, but at some point you got to get in the pool. And the sooner you get in the pool, the sooner you're going to actually know what it feels like to swim and learn your own style and gain some confidence and gain some strength. So the other thing we do a couple of times a month is have an entire separate 2.5 hour deep dive case dissection. And so in addition to all of these examples, we have a practitioner in the class do a live unscripted mentoring session with me that students get to participate in as well. So there's a lot of case practice.
Those cases are just life-changing because, to your point, Tracy, you could learn, you read. I already had read quite a bit, and I thought I knew so much. But until you understand the order of things, the right questions to ask, what would you do with this client who only has a $400 budget for lab work, or only a $200 budget for lab work, or they don't have any money for lab work, or they don't want to do any lab work, or they only want to do 3 supplements? What are you going to pick? So this is the nuances that we talk about in these cases, and it's so helpful. It's just like night and day being able to bounce those ideas. There's also these tribe mastermind groups that are small groups within the school. You'll have other acupuncturists probably in your group because there's so many in the school already. But it's led by a graduate or advanced student in the school, and you meet once or twice a month to go through, and you can ask questions and get answers and ask how are you incorporating this into your practice? What are you doing? Just so many resources within the school. But I want to tell you, this is a real live case of a comment from your group, Lisa, from Sylvie. And she just signed up for SAFM last September. And she said, I took the leap and started SAFM program in September after watching your interview with Jody Franklin, me, an SAFM alumni. Within the first months, I learned valuable lessons from Tracy that helped my clinic staff improve office systems, streamline my case taking, and added income from supplements that complement acupuncture and TCM herbal formulas. Most importantly, I was able to solve a 7-year gut health problem with that my husband suffered from that eluded my TCM professional experience and all the procedures Western trained medical specialists put him through. For this, I am forever grateful to you, Lisa, and to SAFM. As I begin
Wow.
as
What a lovely testimonial. Sorry.
So she just goes on. As I begin to plan for retirement from my established acupuncture practice over the next 2 decades, an SAFM certification along with my TCM education offers me the possibility of continuing to help many people as possible via telemedicine worldwide. And that's something, by the way, that I plan on doing. I'm going to be 60 next year. When I retire, I still want to do this. I want to work just maybe 2 mornings a week and still make a full-time income doing that kind of work. So, and I can travel and do what I want to do, but still have my foot in the game on my own hours and not be tied down to a brick and mortar necessarily, unless you want to be. So So many options. But anyway, I thought I'd mention that because that's a real life example of somebody in this group who took the leap, did it, and so happy. And I know we had a lot of people from this group that didn't want to be left behind and wanted this knowledge. So super
Yeah.
glad to have you
How
on.
affirming. Thank you so much for sharing that. That's great. And there's really nothing like being able to help in your own family, right?
Mhm.
In terms of a loved one. I know, Lisa, you've experienced that personally too.
Absolutely.
So let me share. I just wanted to include a little bit of technical information here, right? And these are random slides from some clinical courses, right? In terms of the kinds of sort of this nuanced understanding and devil in the detail that you can really learn to master and feel very confidently using. Right? There are known common contributors to acid reflux that can be addressed at their roots, but there's not one set of just two or three things that are always causing acid reflux, right? We have to develop the ability to have a toolbox, but to have a rich toolbox. And in this case, it's a matter of understanding that what's happening, say in the esophagus, is influenced elsewhere in the GI tract. In this case, understanding that the roles and the impact of bile go well beyond digestion of fats, and that we can have challenges with regard to bile function. It's not just about having gallbladder disease. Um, and in fact, there are common life situations and circumstances that can contribute to challenges with bile function or with gallbladder function. And like we were talking about here, the um, the high estrogenic state contributing to hypersecretion of cholesterol into bile is an important point of what we call interconnectedness. That can obviously create that holistic type of connection that helps us to see what's at play in a unique case. But I want to introduce you to a really quite different case. This is Jose, a 51-year-old man at the time, who was actually struggling with recurrent IBS. And this was frustrating for Jose because he had struggled with multiple bouts of IBS and had actually been prescribed repeated courses of antibiotics and repeated regimens of herbal antimicrobials. Now, Jose was frustrated in part because he was quite healthy at 51 years of age and had not had any prior health challenges of note. He had had a pre-diabetes wake-up call from his primary care physician a few years back. But other than picking up about 10 pounds of extra weight over the past few years, he had otherwise been quite healthy until this revolving door of IBS began about 3 years prior. And Jose had been formally tested for IBS with breath testing. And in each case, he felt like the antibiotics worked or the antimicrobials worked, but only for a little while. Maybe for 2 months, and then slowly his symptoms would come back. Maybe for 3 months, and then he would have a resurgence in the fourth month. And he was frustrated with the cycle of recurrence. And so Jose started working with Sue, a practitioner, in order to try and get at the roots of his IBS. And Sue had actually been supporting him with a number of lifestyle changes. Thankfully, Jose's diet was actually already quite healthy based on that pre-diabetes wake-up call. He had already worked to make his diet lower glycemic. He had added healthy fats to his diet and taken out sugars and sweeteners. And actually, over the past year, even had been eating a grain-free diet. And so he, in particular, wasn't consuming any grain flours. And Sue was helping him with a number of other prominent common contributors to IBS from a lifestyle perspective, helping him to improve his eating hygiene in terms of more thoroughly chewing his food, appropriately hydrating, which was definitely something Jose had trouble with. Sue had access to some lab work that she well understood indicated some actual overt deficiencies in both magnesium and zinc. That would be important for IBS because, as I mentioned earlier, magnesium is key for appropriate relaxation and contraction in the GI tract, and in particular, appropriate motility. Zinc is essential for immune function and being able to maintain appropriate microbial balance and stopping this cycle of recurrent overgrowths that were creating his symptoms. Sue recommended a good quality probiotic, and she also recommended that Jose support his digestion with hydrochloric betaine, which is a supplement that increases the acidity in the gastric cavity as a way of helping us to denature and degrade our foods. All very logical typical protocol items for addressing IBS. And Sue even went beyond that in terms of looking at a number of the more complementary types of influences, helping Jose to get outside more frequently, to get a bit more daily exercise. Jose enjoyed playing tennis a couple times a week, but working with Sue, he started to take walks on a daily basis, getting some fresh air, helping with his circulation, started getting to bed a little earlier, started emphasizing his natural preference for prayer as a spiritual practice. Again, all very appropriate considerations with regard to creating IBS. But in Jose's case, in particular, 3 months later, still struggling. In fact, in the middle of working with Sue, Jose's symptoms started to worsen as he reached the 2.5 month mark from the latest set of herbal antimicrobials, and his bloating and distension started to worsen while working with Sue. And so, again, still struggling and frustrated. Patient is frustrated, practitioner is frustrated. And it's yet another example that if we can't nail the nuances, we're going to struggle to help people to truly get disease resolution. And if we don't actually nail the nuances, then we're for sure going to struggle to create raving fan type of results. Now, in Jose's particular case, again, there are some nuance that have to be considered. It stood out to Sue that Jose had had pre-diabetes diagnosis, and in the case of assessment and support that she received from her colleagues, they reminded her that when there is endocrine pancreatic dysfunction, like with type 2 diabetes, this often creates exocrine pancreatic insufficiency. And in fact, research shows, depending on the study, that between a third and a half of patients with either type 1 or type 2 diabetes have pancreatic insufficiency, meaning the pancreas is not putting out sufficient digestive enzymes. And this is a wonderful crossover between metabolic and gastrointestinal disease. And so anytime you're looking at a case of pancreatic disease or diabetic disease, we want to be questioning whether or not digestive enzyme support might be a key contributor. And indeed, it was in Jose's case. And so adding in a good full spectrum digestive enzyme formula started to bring him some relief right away for the distension and the gas. When we don't well digest our own foods, what it actually creates is greater food fodder for our microbes. And so this excess metabolic fuel, if you will, for bacteria contributes to the frequency of their overgrowth. And this can definitely set up small intestinal bacterial overgrowth that can create pretty debilitating IBS. The other thing that Sue got some good input on is the fact that when you thought about it with a beginner's mind, it didn't make sense that Jose was struggling with prediabetes because he had been consuming a good, healthy diet for quite some time, and he was still showing a marked elevation in his blood sugar, in his hemoglobin A1C, despite a dramatic reduction in glycemic load from diet. And it's amazing to me, actually, how often in functional medicine we see that it's not the diet, but rather the effect of stress hormones that is increasing blood sugar. And people can have a seemingly ideal diet and still struggle mightily with chronically increased blood sugar because of the effects of stress hormones. And what stood out on Jose's intake was that he complained of morning fatigue. Now, Jose had been getting to bed earlier. He did not claim to have any challenges with sleep, but morning fatigue is one of those common complaints that we should never toss away. We always want to investigate, why is that? And in fact, a discussion with him led to an inquiry with his wife, who was quick to share that while Jose slept the night through, he often slept restlessly. And as she put it, every so often he had to wake up and catch his breath, which should stand out to any of us as being likely evidence of some breathing challenges, and a sleep study referral uncovered sleep apnea for Jose, and that he actually struggled with stopping breathing several times during the sleep study night. And this can be a really dramatic driver for increased stress on the body, and through, in particular, much higher levels of adrenaline in the moment, and then cortisol across the entire 24-hour cycle. This can be a huge contributor to increased blood sugar. And so the opportunity to help Jose began with the gut, but we were actually able to use some additional targeted dietary changes and berberine as a plant extract in order to help improve his insulin sensitivity, get him some good support for his sleep apnea. And actually, 4 months later, this of course took a little bit of time. Not only did he not have IBS symptoms, Jose was able to get his hemoglobin A1C down to 5.3%. So no longer pre diabetic. Not a surprise that this ends up being an individual who's wildly satisfied. And in fact, Jose was so excited by working with Sue that he actually trusted her enough to refer his family, his mother, his sister, and his brother, to her practice. And this is a great example of interconnectedness in the body that's quite different than from Marilyn's case. When we have a dysbiosis in the gut, in particular, opportunistic overgrowth, we get higher levels of microbial debris, and in particular, uh, uh, en- uh, endotoxin called lipopolysaccharide, right, which is fragments from gram-negative bacteria. And when we have higher levels of lipopolysaccharide, it can actually interfere with insulin signaling and can easily be contributing to metabolic disease. A great example of how what happens in the gut doesn't stay in the gut and can promote systemic dysfunction, and how systemic dysfunction can be causing GI disease. And the lesson here, of course, is that based on these nuances, no amount of antimicrobials was going to fully resolve these cycles for Jose. It doesn't matter what antibiotic he used, because we weren't addressing the terrain, right? The underlying environment that was precipitating, that was enabling the dysbiosis. And so again, we were able to reach, and similar to the cases that Jody described, it's not just about giving people symptom relief. It's actually about getting at the roots of functional imbalance and correcting them, so that people get tremendous relief from things that even go beyond what they came to you supporting as primary complaints. This is a powerful way to create raving fans, to create qualified referrals that can seriously help to build your practice. And so I share these with you because they're two really different examples, and it's just a tiny, tiny subset of, maybe 10 factors or so out of hundreds of them that you can learn to work very confidently with, right? It's a good reminder that when you've seen one case of IBS, you've seen one case of IBS, and we have to be able to dig more deeply into understanding what is causing it for a unique individual. And only in finding those nuances in the unique case do we have a reasonable hope of wildly satisfying someone. I want to give you some additional data here. So the prior slide is a bit of a checklist with regard to IBS in terms of things to look for that might be at play. This is a bit more information about pancreatic insufficiency and some references with regard to the overlap between that endocrine and that exocrine dysfunction that I believe is really quite common, especially given the increasing epidemic nature of metabolic disease in most of our practices. But I'm sharing these examples with you because they're fairly commonplace in our community in terms of creating wildly satisfied patients and clients who become raving fans, and by virtue of dramatically improving patient outcomes and standing out as an expert in your field, you naturally accelerate your business growth, because raving fans want to give you an amazing testimonial. Raving fans want to tell their friends, their family, their coworkers, random people at the gym about you and about your services. And this really frees you to have a full practice. As Lisa and Jody well said, you also have a lot of creative opportunities. You can have part virtual, part brick and mortar. You can do some individual, some group. Um, you can work in different relationships with other practitioners if you wish. There are lots of options for how you can creatively structure your practice in order to be as busy as you want to be, but to get out from under the sort of just trading straight hours for dollars, that is naturally going to limit your income potential and put a tremendous amount of pressure on an awful lot of marketing, which is fine. We all need to do a certain amount of marketing in our business, but we don't want to end up spending uh, too much of our time marketing ourselves when we want to be doing the clinical work, right? We want to be practicing our expertise. And the reality is that whether your focus, your passion is fertility or metabolic disease or autoimmune disease or longevity, so much disease begins in the gut or is exacerbated there. It's really the most important area for practitioners to master if you really uh, have a vision of truly getting at the roots of disease and setting yourself apart as that type of practitioner.
Excellent. I could say, like, I have people telling me, "Give me a stack of your business cards. You helped
Yeah.
my daughter or whoever overcome anxiety. I want to tell more people about you." And it's not just me. I mean, it's just about every student in the school will tell you similar stories. So it's amazing. So can you tell us about the gut course? Because we're getting to
Yes, I
yeah.
would love to. In fact, what Jody is alluding to is a special separate program that I want to make you all aware of and invite you to consider. Because, as I said, if you're going to master one area through the functional medicine lens, um, I recommend it be the gut. And it's a powerful opportunity to really jump right into functional medicine interconnectedness and explore if it resonates with you and explore applying it in your practice. And we've curated the very best of all of the educational content that we have on the gut and on essential gut balance and imbalance and put it into this program. The curriculum we pulled together is otherwise worth just over $1,600. But we have priced that at 697, but we're offering it now for a limited time for only 497. And this is a 6-week deep dive into learning how to assess and resolve this type of nuanced gut imbalance. And it's
And
something I invite you all to consider.
I just want to say you all can start this course today.
Yeah.
So if you get the course, first of all, 497, hello, that's like 1 day course. This is like a 6-week intensive. It's amazing, 6 modules, and you can get through it in a week if you wanted to, but you have 6 weeks to get through each module. And I have someone who signed up recently. She said, I did it all in a week. I was like, oh my gosh, she's like on fire. She can't wait to take the next class, just like me. But yeah, I mean, this is just amazing for only 497. And spoiler alert, if you want to do the certification after, like that student I was talking about earlier from this group, you can take that 497 and put it towards the certification program. So it's like getting this program for free. So this is a great way to dip your toe into functional medicine, start getting good patient or better patient outcomes. I shouldn't say good. I'm sure you guys have excellent patient outcomes, but to take it to the whole different level, tell your patient who's on the table with you, how would you like it if I could review your health history with you and give you some suggestions on how to get better results with, and then you transitioning it into functional medicine sessions. You could charge more for these sessions and just even if you're doing this on the table and helping them with suggestions, they're going to tell their friends about you because you're getting better results for them. So
Yeah.
Lisa, can Lisa put the link in the comments right here? And if you're on Facebook, it's in the comments below. So use that link and you can sign up today for it and start getting better results right away. But this is me, the why behind the program. So much disease begins in the gut. Hippocrates himself said it does. And you can wildly satisfy the patients who come to you. And I get messages like this all the time. This is literally from one of my clients. I want to thank you for changing my life. I feel better now than I felt even as a child. I wish everyone could feel this way. And so I get comments like that every day, and you can too. So I hope you decide to do this.
No, thank you for that encouragement, Jody. I appreciate it. There are literally hundreds of clinical insights and practical case considerations in the course. It is self-paced, as you said, so if people want to dive in and really aggressively pursue it, and you can obviously go back and review the material as often as you wish. It's 12 hours of webinar. It covers many different common, often overlooked roots of recurrence in GI dysfunction. It is applicable for all modalities. Wonderful opportunity to learn from the perspective of functional medicine and apply it right through the lens of, in this case, acupuncture and that particular lens on the body. But there's a couple of things here that we purposefully included as bonuses that I just want to highlight. One of them is not specific to the gut at all, actually. This is a whole segment on what we have learned and teach at SAFM about the most common practitioner missteps in clinical engagement. And this speaks to the fact that any of us can have lots of knowledge around what would be appropriate for a given person, but so much of efficacy and impact in working with a unique individual is about how we engage with them. What do we empower and inspire in them? And so we talk about some most common missteps in this space that impact your efficacy. Whether this person keeps coming to you over and over and over again, whether they walk away, whether they refer people, whether they get a little bit of benefit or a whole bunch of benefit. So this is obviously applicable to any type of work, not just the gut, but we wanted to include that to make sure that it's not missed by students in this course, because at SAFM we put a huge focus on the applied aspect of functional medicine. We also ensured access to continuing education credits. And so for uh, a number of modalities, there's an opportunity to get up to 10 CME, CE requirements, credits, sorry, while actually learning something truly transformative. And so that's available as a bonus. And then the other thing that we have is an exclusive opportunity just for students in this course is the option to opt into an ongoing monthly complex case practice for literally $1 a day, which is, we've never done anything like this before. I'm super excited. We've been doing it already this year, and it's really a lot of fun. But this is a deep dive into a current, rich, complex case for a couple of hours each month. And we pull together clinical pearls from the case, and I do a follow on video of insights into the case. The only way you can get into this program is via this course. And so this is a wonderful opportunity to get ongoing clinical practice in using applied functional medicine in order to build confidence, in order to build that richer clinical insight in supporting all sorts of unique individuals. And so I think it's a wonderful collection of resources and tools and clinical know-how that I really invite you to consider in terms of taking your results to the next level.
Yeah, and you can see a few other testimonials here, how it was packed with such useful information. This is from an MD in the program. These are from the actual gut course, and you can also see it's informative, well organized, thorough, detailed, insightful, clear, thought provoking, well researched, intellectual with facets of biology, chemistry, and physiology. Such a fantastic deep dive into functional medicine and the interconnectedness of the gut within the entire body. Tracy, you're one of the most intelligent and incredible teachers I've ever had. And I have to echo that. She's really the best teacher I've ever had. She just teaches this complex info in a way that makes it so simple. And she uses simple analogies and concepts, and it's deeply rich and steeped in science, but it's makes it easy to take to your practice and easy to explain to your patients so you can help them get really breakthrough health results. So I love that. And
Mm,
then I think there was one more.
thank you.
Yeah. So a couple more here. Great course. I didn't learn any of this in school. Lots of great information applicable to clinical practice. Tracy did a great job explaining it all. And also, she's made an impact on her practice and future patients. So, it's such a great resource. I hope you all decide to do it. This is one more. She thoroughly enjoyed and appreciated it. It's given her a new level of excitement about helping some of my own difficult to treat patients. So you can see lots of rave reviews about this class. I think every single one, everybody who does it is just saying, oh my gosh, she so over delivers on this. It's just amazing. But
Mm,
you
thank you.
want to invest in yourself. I mean, show up here, get raving fans, take your practice to the next level. People are out there looking for competent functional medicine practitioners. People, I don't even know how they find me anymore, but they're looking for people that are good at this. And you could be doing this work very easily by going through this program. So you can start using it and start getting this financial abundance and success, have people lined up to work with you versus waiting, the cost of inaction. How much are you draining yourself trying to advertise and get business going? It can be a bit of a downward spiral. And I think if you're waiting for growth, it doesn't happen organically. It happens when you're really, really good at what you do and people will just rave about you. And those are the easiest people to sell. When people come in and someone else, it's one of their friends or family members has been working with you, they're just like, where do I sign? They don't even care what the price is, honestly. They just want to work with you. So makes it effortless and amazing. And I can't wait to wake up and work with people and get them results. I just love this work. It's so much fun.
Yeah, I appreciate that, Jody. And we've been talking here about the type of growth and abundance, right? That's possible. I love the vision you set for yourself for next year. I can't believe you're going to be 60. Um, but
Another
the
benefit of
reality is
functional
that our
medicine.
future is going to come, right? I mean, the future is going to happen, and I want to see inspired progressive practitioners set up for reliable growth and financial abundance and stability, because it takes away from our capability and for our enjoyment in practicing our passion if we're worried about not having enough financial stability, not being able to pay the bills, not being able to keep our dockets full. This really takes away from our vitality. And so I really want to encourage everyone to invest in creating the future for your best self. And if this resonates with you, it can be a powerful opportunity to do that. But for sure, we need to proactively create and set ourselves up for alternative practice and income streams in order to create that creative set of options for the
Yeah,
future.
the future's coming either way, right?
Absolutely, absolutely, yeah,
You can't
for
stop
sure.
that.
So I'll end my part here at least. I think that being part of healthcare transformation is really important work. It's really essential work, and when progressive practitioners show up to do this work, for me, optimizing clinical outcomes is not just about the patient feeling better and getting amazing results. The practitioner is part of the clinical outcome, and practitioner fulfillment and vitality and abundance must be part of the equation, right? In order for all of us to find the energy and the enthusiasm to do this work in a sustainable way. And so for me, and at least for us at SAFM, we take that part very seriously in terms of taking a stand for your vitality in this equation as well. So I appreciate very much the opportunity to share some clinical insights and some motivation today, Lisa. Thank you very much for the opportunity to do that. And again, I invite you all to consider if this opportunity resonates with you.
Thank you
Yes.
so much, Tracy. And thank you so much, Jody. And especially for having this discounted price to be able to get in and, like you said, dip your toe into the functional medicine training. I especially love the way you did these case studies. Instead of them being the more common, this was the problem, this is what we did, and the patient got better. I like the way this is what the patient had, this is what we did. They didn't get better. Here's why, and how we modified things and intervened to help the patient not only resolve the issues, but find out what the root of the problem was that was driving the disease state in the first place. So I really, really like the way you put those pieces together. And I'm kind of bummed out because I took a whole bunch of notes and I'm not practicing anymore. And I want to be able to use this information.
Little Lisa, there's always an opportunity.
I know. You guys are in the back of my mind. I've told my husband there is a chance that I will, because I know I can do this virtually.
Mhm.
There is a chance that someday I will actually come into SAFM myself. So in
I
the
love that.
meantime, I just want to say thank you for giving this perspective and for sharing this wonderful opportunity for acupuncturists to, combine functional medicine and the way you show how to apply it. That's where I have found the biggest difference with what you do and how you train with other types of functional medicine programs. So thank you again for being here. And if anybody has any questions, I know Jody will hang out in the group for a while to answer questions. So feel free to add them. I know Tracy, you're super busy. So thank you again for taking the time and energy. My goal is to get as many acupuncturists into your program as possible, because I just believe the combination is a superpower. So thank you again.
We've had dozens from this group already do it. So
Wonderful.
it'll be
Yeah,
less
we
than
have.
10.
It's in fact,
Yeah.
I meant to do a tally before we came in today, but it is dozens. And so thank you so much for that support. But I think the results that acupuncturists are able to integrate into their practice speak for themselves. I think it's wonderful. That's great.
Well,
Thank you
it's
again. I
definitely
appreciate it.
win, 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 win everywhere. I love it where you said where the practitioner is part of the patient outcome. I
Yes.
love that you focus on that. So thank you again. You guys have a great day. And I will see you very soon. So thank you.
All right, great. Take care.
Thank
Bye-bye.
you.